Okay.
Got it.
Okay, here we go. Thank you, Chuck, for coming on today. You've been part of this for a while now, and super excited to have you. One of the first physical therapists that I've ever been able to work with. And you've been a physical therapist over 30 years, is that correct?
That's correct.
And you're based out of San Diego,
Well, Southern California, and
Southern
it's like
California. Okay.
Temecula wine country area.
Beautiful. So, I've said this for about 3 years. This is one of the most versatile medical devices that you ever heard of. And it delivers low intensity supersonic sound waves that stimulate the body's innate healing ability. And after having this for a while, almost a year now, what do you think? What are you seeing in your clinic?
I see miracles almost every day.
Isn't it cool? What would be considered medical miracles? Well, as much as I love this device the last 6 years and what it's done for me, and um, it seems like every other month we find a new condition that can benefit from this technology. So I've seen the light. I've worked a lot with spinal biomechanics, ergonomics, what happens with a car crash. I went through Arthur Croft's course.
Okay.
I did a lot of chiropractic biophysics, and I've seen the light. And this is electrohydraulically produced supersonic sound waves. It is utilizing light and the clasp of thunder. It's harnessing these two natural occurring phenomenons, putting it into an applicator that we can point at the human body and literally create a positive biological effect. It decreases pain and inflammation, as well as improves circulation and range of motion. So I think this, combined with some of the skills that we've learned in school and working with acceleration, deceleration injuries, that this might be tapping into a new vertical. Okay.
Mm.
So, back in 1996, world renowned, the Spine Journal came out with a supplemental issue. And they said, listen, we are losing the battle on a worldwide case the way we treat, diagnose, and triage whiplash. Okay. And in fact, it documented that 2 years after a motor vehicle accident, 20% of injured were still having moderate to severe pain with a VAS score of 6 to 8. Okay, so that's still pretty intense. They also said they needed a better way to diagnose soft tissue injuries, as well as a more efficient form of treatment to handle these conditions. And this is where it was right here. Uh, and they basically said the the burden of whiplash injuries, the high rate of transition to becoming chronic, and evidence of limited effects of current management uh, really demands new direction and evaluation in management, writes one of the expert panels, Dr. Joel, PhD from the University
She's
of Queensland.
she's a PT, by the way.
Is she really? Good to
Yeah.
know. All right. And then they also went on to say early detection treatment can prevent acute whiplash from becoming chronic. And that's the problem. I think until I recently was on a great call with Dr. Jeffrey Kronk, who's also a chiropractor as well as a lawyer, and he specializes, he created the Smart Injury Doc. And he really just opened my eyes to what happens during whiplash injuries. And why this has been kind of like the Bigfoot, right? We couldn't find where the pain was coming from. But early management may have a critical impact on the long-term outcomes of whiplash. Many different approaches have been tried, ranging from exercise to immobilization to acupuncture to electromagnetic. None of these treatments have been convincingly shown to reduce the risk of whiplash symptoms. And then they turn on to become a chronic problem. And my patients were always like, oh, I'm fine. I'm fine. I've said metal and steel of a car are crumpled. You don't think that force is transferred through you? Oh, I just want my BMW fixed. You know what I mean? That's no, you also have to make yourself get your, I'm fine until you check my spine, is what I say. So you know what happens with a whiplash injury? There's this, I'm going to go over the mechanics of it a little bit more, but 33% of whiplash injuries go undetected at ERs. And you know, that's huge, because motor vehicle injuries, they take x-rays, and x-rays look at bone, and so they're inadequate 35% of the time, and there's an absence of symptoms on that first visit. The true effects of a car accident might not show up for 2 hours to 2 days to 2 weeks after. Would you agree, Chuck?
Oh no, yeah, I have some knowledge about this area. So yeah.
Yeah. And there's misdiagnosis, because a lot of times, if you're looking at the side, if these are the vertebrae in a side view, a lot of times in that flexion, you've got this hyperextension flexion type of deal. And remember, ligaments hold bones to bones, right? They're like rubber bands. And if they get stretched too much, it's not a good thing. So this is important. Ineffective treatments as well, 29% of the time. This basically is what, on the left, is what a normal cervical spine should look like. From, you see that green line, right?
Mhm.
And this is someone who's been in, had a cervical injury or a high speed acceleration, deceleration. And you see the green line where they should be, and red lines where they're at. Now, remember, the spinal cord is back here. That's putting a kink in the spinal cord and torsion. It's also putting unnecessary force and stress on these intervertebral discs. And for 50 years, we always thought the pain was coming from this. This is like taking your finger, pinky, and pressing it way back like this, and then walking around like, you know? Oh, if you hit your finger on the steering wheel and slightly dislocated it, you'd see it every day. You'd pop it back in place. But what also, see where that red arrow is?
Mhm.
These spinous ligaments are damaged, right? These interspinous ligaments and these capsular ligaments are, we're finding, is where the true source of pain is coming from. Okay. And you can see what happens to the vertebral body and these facet joints that also have capsules. So this is where we see this damage, and after the injury, it sometimes heals in this position. That's why an acute problem can become a chronic problem. And then those chronic people, this is a mechanical issue. Okay. So again, yellow here on the left is where the brainstem is, and then the spinal cord. The vertebral body actually protects, and the arches of the spine protect that fragile spinal cord. They're named three different things, but they're all part of our central nervous system, right? And that spinal cord has nerves that branch off and go to every cell, tissue, organ, body, muscle in our body. And this is just a good idea of the frame. You guys can see it. The patient is, his face is to the right, okay? And this is just all the vertebrae and all the facets. So oftentimes what happens is, the way the injury occurs, when you get hit, your body moves first and then your head goes back. So you create this S curve in your spine, okay? So there's a mechanical stress, but also there's a physiological effect on those ligaments. So mechanism of whiplash injuries affect those small zygapophyseal, I can never say this word, zygapophyseal joints that are interarticular in nature, and have a joint or a capsular joint there, and have little ligaments around it. We're going to go in there a little bit more. So, this is where a lot of interventional doctors are injecting into that facet area where the damage or pain is coming from. So they'll do blocks to find out. And this is a side view again of the spine and the facets and the capsular. You see the needle going in. This is Matt Powell. I've known Matt for almost 20 years now. He's an amazing personal injury attorney out of Tampa, Florida, and he really understands the human frame. And I'm going to let him explain a little bit here, Chuck, because I think this is an important concept.
I'm not hearing it.
Okay, let me change that. Thank you. Okay, here we go. Oh, can you hear it? Hold on. Speaker. Okay, here we go.
No, sir.
Explanations of the laws of.
Okay. Did you hear it?
It just started going. Yeah.
Okay. I'm getting rid of these. They were going through my. So he's talking about the laws of physics. Here we go.
Let me show you what happens in a simple rear-end car crash. Before the moment of impact, the person inside the car and the car itself are resting without motion. As soon as the car is hit from behind, the mass and energy from the moving car begins to transfer energy into the stopped car. What most people don't understand is that the body of the person sitting in the stopped car will not move immediately with or as quickly as the car they're sitting in. But instead, there is a lag in time before their body starts to move. In this graph, we have time going along the bottom and G-forces are on the left. The steel frame of the car being hit will begin to accelerate forward from the impact. However, the person in the car will resist moving due to Newton's law of inertia. What will happen is the vehicle will begin to move before the occupant. The vehicle may actually move several inches forward while the person's torso begins to increase pressure against the back of their car seat. Note in this picture how the driver's hand is off the steering wheel. Then the pressure from the seat shoots the torso of the human body forward like a diving board propels a diver. The torso moves first, and because your head is somewhat like a bowling ball supported only by your neck, your head will remain motionless for a few more milliseconds. So the car moves first, then your torso moves out from underneath your head. This forces your head to suddenly have to accelerate to catch up with the car and your torso. This very sudden acceleration of your head causes 2 points of stress in your neck. The first stress point is at the cervical vertebrae C5 and C6, and the other stress point is between the cervical vertebrae C1 and C2. These two areas of our neck usually get the most damaging forces, which oftentimes tears or permanently stretches the ligaments that hold our vertebrae in their proper place.
So I'm going to ask you to unmute. Chuck. Okay, good. So this is a close-up view. The one on the left is a 45-degree angle where you're looking at that capillary facet joint. And it's like the old rubber bands that made up a golf ball, you know? And that's the way that disc is as well. But you can see those facet joints actually have, you know, a fluid, a synovial fluid in there. They are a little joint. So when you get that flexion, you actually open up and you can tear or damage those, okay? Just like a rubber band gets old and frail, it can break. So again, here's where a lot of the ligaments are, and you have an anterior one. You have the posterior lamina line, and then you also have that spinal laminal. All those areas have ligaments with them as well. So ligaments are thick pieces of connective tissue. Remember that word, connective tissue, because that's important. And we can see how that's going.
There are the ligaments, so kind of a close-up view of that. So they're thick rubber bands. Again, there's on the front and the back. And again, you can have different stages. You can have a grade 1 tear, grade 2. Grade 1 is 25%. Grade 2 is 50%. Grade 3 is 75% of that ligament is torn. And obviously a complete tear is grade 4. And again, these are the ligaments that hold the body together. They stretch, help us give us motion. Ligaments hold bone to bones, but they do have a physiological endpoint. And after damaged, they can sit with a mechanical stress in that area and cause abnormal wear and tear on those facet joints or those little capsules. So fast forward 2017, after searching over 22 years for something that could be used both as a diagnostic tool, but as a healing modality, I stumbled across, I met John Warlick, April of 2017, and 6 years ago today. And the coolest thing is that this is repurposed, right? This is 40 years. This device has been utilized to break up kidney stones using supersonic sound waves, but has been repurposed for the use of general pain and soft tissue. I mean, our company's name is Soft Wave Tissue Regeneration Technologies. We have a Class 2 clearance to activate connective tissue. When you run this over normal tissue, there's no pain. So a lot of professional sporting teams are using this to map out and really pinpoint where the true source of pain is. But when you run it over areas of poor circulation, inflammation, arthritis, or damaged tissue, there's this biofeedback component where the patient will be like right there. Have you noticed that, Chuck?
Mm-hmm. Yeah.
Good. And so, I felt like a kid, like when I was young and watching Mad Magazine, I used to love this thing in the back where you could be like, get X-ray vision, right? This is what it feels like when I'm utilizing this technology. It's allowing us to peer into the body and using that biofeedback component, find where the true source of pain is coming from or that damaged tissue.
The three common treatments for pain, pills, cortisone, and surgery, are either ineffective, invasive, carry massive side effects, or all three. Non-invasive soft wave technology offers better results and faster healing with little to no side effects. Backed by 46 patents, soft wave's same-day 10-minute procedure uses supersonic sound waves to increase cell membrane permeability and recruit and release the body's own repair cells, thus activating our natural innate healing mechanisms to provide lasting pain relief. So patients heal faster, feel better, and experience life pain-free, without drugs, surgery, or shots.
So supersonic sound waves, we see these in nature all the time. We see it with the lightning and the clasp of thunder. We see it, you see it out there in Southern California, right? With the Miramar down the road. These supersonic jets are, when they break the sound barrier, they're traveling 765 miles an hour. We have what's called electrohydraulic. We have a spark plug that creates that supersonic sound wave, but then we've encapsulated it in water with a parabolic reflector. And you're going to see that our technology will go the depth of a soup can into the body if necessary. The one on the left shows our supersonic sound waves. It looks like a cardiac wave, right? It's high pressure followed by low pressure. And we are the only device company on the planet that has a primary and secondary sonic sound wave. This is more like a pressure wave. And if you looked at an old ultrasound from 1950, that was the wave. It's just a sine wave. And the radial acoustic machines, they're not genuine lithotripsy. They're not creating supersonic sound waves. They weren't made to break up kidney stones, but they're a little metal stylus that pounds on the tissue and literally creates trauma before the angiogenesis. It's trauma, cytotoxicity, which is death of the tissue, and then angiogenesis. With our technology, we use mechanotransduction, so there's no damage to the tissue. And this looks at all the different types of devices out there. You can see the bluish purple is the ultrasound. The black dotted line is a radial pressure wave, and the red one is genuine extracorporeal shock wave therapy. This is mechanotransduction. This is a concept that's so important. You hear me talk about it every month, don't I, Chuck?
Yes, sir.
In this, you can see the cell membrane. We're working on a cellular level. So the cell is being compressed, as you see in the compression phase, by 2%. And then with the second part of the wave, the negative tensile force that you can see when the wave goes underneath the x-axis or that horizontal axis, that is the expansion phase. So it actually expands the cell by 10%. And that shearing force that happens every 3 to 4 microseconds knocks off oxidative agents and also exosomes, messenger RNAs, and extracellular vesicles. Those are all stem cell attractants. So it's working with your innate immune system to call in those first responders, the healing, the fighters, and the repair cells to come and find out what's going on here. We know there's a wide array of biological effects. Pain relief is probably the number one. We see a reduction in pain within 3 visits. It has anti-inflammatory actions. It lowers the pro-inflammatories, those toll-like receptors 3 and 4, which helps us modulate inflammation. And, that's really the silent killer, and that's where the main culprit of pain is coming from. And people say, well, how do you know that? And I said, because when I put this device on there, their pain goes away. And inflammation is reduced and circulation's improved and their range of motion. I say it all the time. It's like WD-40. But it's activation of mesenchymal stem cells within minutes of treatment. And we see after 45 minutes, those stem cells are called into action to help start repairing whatever damaged tissue they're going to come to. And these are embryonic in nature. And we also see tissue remodeling and regeneration. When you decrease that inflammation, it gives your body time to repair, recover, and start the regenerative process. Our patented reflector, as you can see, helps us penetrate the depth of a soup can into the body. We're producing a true shockwave that helps accelerate healing. I love this animation because it shows the unfocused, meaning the whole bottom of that soup can, that whole cylinder you see is a positive biological effect. And it comes from this patented parabolic reflector that you can see up here. And it's like an old, it's like the headlight from an old antique car because it's using that concavity but that's a cool slide, right?
Oh, I love it. That's good.
Now watch how deep we can go. So we use the yellow one is the unfocused probe, and you can see how deep it can get into the tissue. That's 6.4 to 8.2 centimeters in depth. And again, we use the yellow one, so I'm going to focus on that today. But this is from Professor Cyril, and he's a great guy. He's from Austria, but he's a physics professor and PhD at Utah Valley, and he's done a lot of research for us. So let's this is a vertebrae of a cow, and you can see, or a pig, I'm sorry.
Right side actually model the sound fields as they propagate and distribute themselves through, in this case, the spinal cord. But it allows us to.
So you see the depth of that, correct?
Mm-hmm.
So that's penetrating. Now 50% of those waves are absorbed by the vertebrae, but you can see the other ones are penetrating through that soft tissue. And that's where we need to get. We need to get deep down into that facet joints or those zygapophyal joints to get to the healing mechanisms. Nothing else that we've ever seen in our lifetime, Chuck, and you and I are old. has ever been able to help with this. We're FDA cleared to activate connective tissue. This is a class 2 clearance. Connective tissue is the fabric of life. It's the matrix of everything from nerves to bone to brain tissue to organs to even adipose tissue. So we have also we get paid by Medicare to treat chronic diabetic foot ulcers, acute second-degree burns. This is also a registered class 1 device to help reduce pain and improve circulation. But if it's allowing tissue to regenerate in a wound that's been there for a long time, think about what we can do for a chronic whiplash patient that does not have a grade 4 tear in those ligaments. This is proof in the work in the ulcers, effective and versatile, heal from within. The one on the left, you're seeing over a 4-week treatment and 4 treatments. I think it was over 6 weeks with 4 treatments, but that ulcer was gone, that pressure ulcer. This other one on the right, you met Dr. John Mullins. He's one of our medical directors here at Softwave. He's at Piedmont Hospital, and this is a female's talus that was not healing properly. And it was for 4 months, it wasn't healing. And then he did, I believe, 3 treatments over a 5-week period. And this, you can see on the results, it healed. And I love this picture because we found that in Austria workers' comp system, over the last 11 years, we've saved them 70 million euros on helping non-healing fractures heal. There's lots of papers out there now. I love it. Over the last 30 years, you've really saw an influx. The majority of these are coming out of the United States now, which I love, about 1,000 of these. And you can see Harvard, University of California system. We have Dr. Tom Liu in San Francisco, and we have Dr. Erwin Goldstein down in San Diego. So it's coming. This is an emerging field. And you got to be on it. You don't want to miss this boat as it comes through. Again, class 2 clearance, basically wherever we place this on the human body, you see a positive function, activation of connective tissue, decrease inflammation and swelling, improve blood supply and circulation, cell recruitment, repair cell recruitment and activation within minutes, improvement in exosome circulation, which are stem cell attractants, wound healing, has an antibacterial and antimicrobial. We've already talked about non-healing fractures, decrease in pain, improve range of motion in these joints, recruitment of innate immune receptors, toll-like receptors 3 and 4, which are important in modulation of the inflammation. And, you know, I had this fight with another PT a while back, but it's like, inflammation is necessary for healing. Yes, at the first part there is, but if it stays in there too long, it actually, you know, it compounds the problem and it slows down the healing process.
The right type of inflammation. Yeah.
Our supersonic sound waves are helping flush that out, and in my opinion, are improving, you know, melting away scar tissue. These are any type of itis, any type of inflammation, but you can see a wide list of applications that we work on: orthopedic, physiotherapy, sports medicine. Dr. Martin O'Malley says if you're doing sports medicine in 2022 and beyond, you need this technology. He's the foot and ankle specialist for the NBA. We have great partners, trusted, used in leading national, international research medical centers, Harvard, Mayo Clinic, Cleveland Clinic. We're in 15 different sporting teams, 5 NBA teams, 3 NFL teams, and 3 Major League Baseballs, including the Atlanta Braves. It's effective, it's proven, it's easy to use, right? It's very user-friendly. How long did it take for you to learn?
Well, you taught me not long.
You came to my clinic, didn't you?
Yes, I did.
Saturday morning for a couple hours and you had it down, and thanks for flying in. FDA cleared. Activation of connective tissue. Again, I gotta repeat it all the time. And this is, she was a wonderful young lady, had 4 failed surgeries. And I'm just gonna finish with this. This woman had lost hope. And let's see if this plays.
Okay, Karen, we're about to start your first soft wave treatment. We looked at your x-rays after doing an examination, and you have quite a bit of pain in your neck and your lower back. Would you mind sharing what you feel like now and just kind of what you've gone through, and then we'll do a treatment and we'll do an after video to see how you feel.
Yes, my name is Karen. I'm here today to try the soft wave. I feel like I've tried just about everything. I'm on a lot of medication. I've had 4 surgeries on my back, and I've kind of lost hope in trying to find a solution to my pain. So I'm here today to try the soft wave.
Awesome. I'm looking forward to seeing what we can do to help you. You are a extreme case of neck and back pain, and we'll see what we do to help you out.
All right, so we are with Karen after her first soft wave treatment. How do you feel?
I feel great. Thank you so much. I've only had 1 treatment, and I've already felt significant results. My pain has decreased. I feel great, and I don't even feel myself because I've been in pain for so long.
How long has it been?
3 years of chronic pain.
Wow.
I've never had 1 day without pain, and right now, I think I went from an 8 to a 3.
In 1 session.
Yes,
And you walk with that cane, and you've
I
been.
have cane.
I mean, it's amazing that you've had such a great experience with just 1 visit, being such an extreme situation. We didn't even know how you would respond after just 1 session. We thought it might take a few sessions, but already from an 8 to a 3 is a substantial gain. We look forward to treating you further.
Thank you so much. Thank you.
You're welcome.
So that's what we're seeing. I mean, I like this. You know, this is really a productivity and profitability increasing system. And, you know, we were featured in an article in Forbes because this is such a transformational type of device. And we now have this in over 700 centers across North America. But I believe our next big thing is helping these patients who suffered after motor vehicle accidents, and they're just, no one's getting to the true source of where their pain is. What'd you think of that?
As far as the whole presentation,
Sure.
I think it's very effective. I think it brings to light all the important aspects of what it takes to get better, as well as where the soft wave really puts in that key factor of the healing component to complete the whole process from disability to optimal function.
Well, I love it. And thank you for being, you know, member of our Softwave University. That is free to join. You just have to, you know, have a friend request into me, Matthew DiDuro, no doctor on it. And Chuck, I want to thank you so much for helping with this process, and greatly appreciate everything you've done with us.
Well, my patients appreciate it, that's for sure.
That's right. All right. Well, Chuck, thanks again. And I look forward to seeing you in the near future.
All right, excellent.